So today starts the 79th day. We're into the 12th week, and I said from the beginning, it's a marathon, not a sprint, that we all have to take a step back, take a deep breath, and realize we're in a new world and reimagine what everything is going to look like. And work together to find the solutions to the problems, not create more problems or throw bombshells or point fingers. We got to figure this out together, people. And I will tell you, I don't have all the answers. So your input does help us. Your input does help us for the things we miss. Like I brought up with the when we were dealing with Rapid, Indiana, and they said, "What are you doing with garage sales?" I'm like, "We never thought of garage sales, never addressed it." So it's things like that that you think you're crossing every T and dotting every I. But again, we can do this together. So I want to start off by saying thank you to all the essential employees. Thank you to everyone that's out there doing the right stuff. Our numbers have been going well. I'd like to say again, no one passed away. To the families that did lose or lost somebody, our condolences and love go out to you in our prayers. But most importantly, we are going in the right direction. So our numbers right now are at 1,686, up 21. And again, when we were at 5 and 8, and we're showing that now that we're doing nursing homes more rapidly, twice a week, that's going to adjust that number. Why you're going to see more of that. And we have currently right now 682 people under mandatory quarantine. That's up 67 from yesterday. We're down one person. We got 6 people now under precautionary quarantine. And we have 14 people that recovered since yesterday. There are now 27 people hospitalized, which is down 2 from yesterday, with a hospitalization rate of 1.6. Yesterday it was at 1.74, so that's good. And we have 3 people currently in the ICU. It's the same as yesterday. So over the last 5 days, there's been an average of 10.4 new positive cases each day. So again, I urge and tell everyone, please, if you have signs and symptoms, get out. We have the mobile testing site out there in the community. We're starting to work with the churches in certain areas to help get our numbers up, to get more people informed. We worked with Albany Housing, and we're continuing to work with Albany Housing to get people engaged. We're right at your doorstep. We're right there for you to come out. We're right there for you to get this done. Again, please, the number is 518-465-4771, 518-465-4771. I've reached out to the Black Caucus. I have to talk to Bill Clay, talk to Wanda Willingham about making sure we engage this community to get people tested that have signs and symptoms. Also, I want to talk about Albany. You have the drive-thru, as always, and you have the site at the Seth Q Arena for the essential personnel, and that number is 1-888-364-3065. Or you can go online, as always, to sign up that way too. And the same thing with Rite Aid in Colony on Central Avenue. Please go to their website and get tested if you have signs and symptoms. Priority 1 Urgent Care in Gilliland, as always, doing a great job for us there. And, what's today mean? We're very close getting into phase 2, which is June 3rd, which I know people probably have some questions with the matrix and everything else. But everything's going well. We're moving in that right direction. We put a plan together early on, working with the other 7 counties. Again, we took the lead on this, and I want to thank everyone that helped with the input to say, here's how we're going to reopen. Here's how we're going to reimagine the workforce. Here's the guidelines that you need. So a lot of these guidelines are already there. To a lot of the questions that I get and different things, they're out there. They're on the state website, their dashboard, and it's in our reopening plan that we talked about, how to safely do this, how to get the certification. Well, I shouldn't say certification, how you can fill out the paperwork to make sure that you follow the procedures and the safety guidelines of CDC and the ones established by DOH and the ones we put out there, and then how to train your employees and so forth, and how to have your consumers come in there and do it in a safe way. So it's all out there. So I want to make that clear. But what does phase 2 include? Office-based jobs, real estate service, rental for store shopping, limited barbershop and hair salon, which I know that's a huge one. I get hit with that one every day. I can say there's a lot of women out there that want their hair salons opened up and they want to get their hairs taken care of. So that is in phase 2, as we knew that was in a different phase. One thing I want to point out, nail salons, I can't believe the amount of questions I got on nail salons. They're not opening. Nail salons they're not in this phase 2, so I just want to make that clear. One of the things with the control meeting I had last night that got moved to 1900 hours was basically I asked a question on dental offices, because I'm getting a lot of questions on that, and clarification. Dentist offices can be open, and different dentist offices can be open for emergency stuff. You know, if you have a toothache, you got an emergency going on, please. They defined it as basically can't be opened up for teeth cleaning, teeth whitening, that type of stuff. But if you lose a cat and you got a hole in your tooth, please, you know, and I've said to the dentist, you go there anyway. They've always had PPE. They're always had their mask and shields and gloves on. So they're used to this. If anyone we can learn from is a dentist office, because this is what they've always done. And so please, to the dentist offices that's been reaching out to us and we've been in conversation with, yes, you can be open. You can be open. And you know, the reason why I brought up about just cleanings, because that's not like an emergency, but cleanings, if you don't get your teeth cleaned, it can lead to bone loss, heart disease, strokes, cancer, gum disease. So there's a variety of things why you should be getting your teeth cleaned on a regular basis anyway, but that's one thing we'll continue to look at. And when we looked at an elective outpatient treatment category, and we were reading it and understanding it, because, and I'll address this to the families that have been reaching out to me advocating about kids with special needs, that they're falling behind. It's something the school districts need to address. So when we're looking at this category, speech, pathology, OT, and all that falls under that, in our opinion, in the way we read it. And the control room pretty much gave us the go that we can add this into phase 2 when we get to phase 2 to open up, and which is it's huge for these parents that have these kids that need to get this type of service. And I want to, you know, I'm glad we caught that in the reading, and we all agree on it, and we can move forward with that. So, which is great news for the parents that, you know, have kids with special needs that need to continue to get services or haven't gotten services yet because of the pause in New York that we've been dealing with. So I want to remind everyone, I suggest you to go to the New York Forward website, which is, you know, gov/phase 2 industries. You'll find examples of what you need to do, from the reading the summary guidelines for signing statements, printing out your documents, completing the reopen safety plan, which I know everyone already has. We've been shut down for almost 79 days, so everyone has these plans in place. Everyone's already been dealing with it. Please continue just to make sure you have all that, so when we're ready to open up, you can. And I want to remind businesses out there that are looking for hand sanitizer. Our control room reached out to us. They said they were going to deliver it to the EOC. And the sheriff will get that out. So there's a number you can call for that if your business needs it, only if your business needs it. And trying to think where I put the number. I had the number somewhere, but
it's up.
Well, maybe you can see that, but I
518-720-8036. 518-720-8036.
Thank you. That's what happens when you don't have your contacts or your glasses in. I can't see that number. But I do want to remind people, call that number, reach out to the OC. The sheriff would be more than happy to get you hand sanitizer. I want to thank the state for getting that to us so we can get it out to the OC, to get it out to churches or different places that need it. So I know there's a lot of different questions out there on phase 2. We're going in the right direction. The hospitalization rate's been good. We submitted our plan. We're moving forward, and things are going good. And that's what we need to continue to look at as we go forward. The conversation I had with General Murphy and Joe Rubito and Mike Evely and Mike Morris and everyone that's on that room, we work together. So we work together going forward to make sure that we can get these answers answered and to businesses, And when we get phase 2, I'll say the same thing. One of the things I brought up in the control room is about curbside pickup. And the good point is that if you can go into Sam's Club and you can go into Walmart and you can go into Target and you can buy clothes and you can buy electronics, that's not curbside, has not been curbside. I don't know how to answer that to business owners that I feel for that are saying, well, why do I have to have curbside pickup for our stuff, but I can walk into Sam's Club and buy golf shorts or shoes or whatever, socks, whatever I want to buy, T-shirts, and if I don't want it, I can put it back down and no one says anything. It's a great question. I honestly, I will look at you and tell you, I don't know. I don't know. And I don't agree with it. So when we hit phase 2, I'd say to Stuyvesant Plaza, to all them great shops that are the backbone of our community, the mom and pop small businesses that employ our kids, that employ our families and pay their taxes here. I would say, yeah, if Sam's Club, Walmart, and Target can do it, we can do it too. You can do it. I mean, because it's been going on. So if you can safely do it and you have it in your plan, I can assure you, I wouldn't say no to that. So these are things we have to look at. But, one of the things we thought we'd bring in one of our salons here to talk about this, because this has been an unbelievable topic that we've gotten more calls on this than anything else, which I understand. So just in a few short days, hopefully we get to phase 2 and we get to reopen up. Jolene, I want you to talk about how you're going to reopen, what you're going through, and your experience so far with everything.
Okay, well, thank you so much for having me here today. And you're doing an amazing job keeping us informed.
Thank you.
During this time. So we appreciate your hard work. And so being closed down for 10 weeks, it's been tough on all of us. We have a big salon. There's 16 of us. And we've all been in the business many years. We've had many loyal clients reaching out to us with calls, texts, cards, buying gift cards. They really want to support us. They've become like our family and friends more than just clients. So in preparing to reopen, we all decided to take an online certification through the Barbicide COVID-19. We all went on and read all the information on how to keep our clients safe. Our goal is to keep our clients safe and keep our staff safe as well. We always practiced disinfecting and keeping sanitation a priority in the salon, so this was just kind of reinforcing everything we've learned from way back when. And basically, we know we have to do things differently. There's going to be a completely new normal now. We've made all our clients aware as they've reached out to us and as we've started scheduling. So we told them, we have done a lot of things to keep you safe and to keep us safe. We installed heavy vinyl curtains between our workstations. So according to the guidelines in the New York Forward opening tools, we read that if you cannot be 6 feet apart, a barrier of some kind is necessary. So our clients know that they will be protected that way. They know they have to have a mask, and if they don't have one, we've told them we'd provide them one. So basically, we've ordered all the sanitation from a company that we use. We've got disinfecting wipes, hand sanitizer, touchless sanitizing dispensers. We've got a sanitation station set up, so when our clients arrive, we're going to be texting, calling, or waving them in from their car. Yes. We've asked them if they could come alone unless they need assistance. When they come in, the stylist will take them right to the sanitation station. We'll have a mask on, they'll have a mask on. If they want gloves, we have gloves. So we're going to be doing things a little different as far as some services we won't be shampooing or blow drying. We're going to give them the option. We feel we're going to do everything to keep it safe, so if they go right to our station, they can get their service done. We will not be double booking appointments, which we do a lot because we're busy and we like to get a haircut in while we're doing a color. We're not going to do that anymore. One client at a time. We want to keep the numbers down in the salon. So we've staggered our schedules so that we're not all there together, spacing out. We came up with a pretty good schedule so that probably half staff or maybe a little more will be on with one client at a time. We'll keep them at our station the whole time. They will cash out at our station, make their next appointment, hopefully in their phone, so we don't have to go get pens and cards and things like that. We'll also, try to keep the flow of the salon differently. People are used to coming in and sitting in the waiting room and having coffee and water and reading a magazine and chatting, and they love it. It's a social day, it's a great experience. Well, we want to keep the experience positive. We want to keep them happy to come and not worried and scared and, is my hair going to come out okay because I have a mask on?
Right.
If you want to take the straps off and hold the mask on your face, that's fine. We can work around it. So we're gonna try to keep the experience as positive as possible. And they're all aware. We've reached out to all our hundreds of clients, and they're all aware of what's going to happen, and they're all sending us thumbs up. Whatever you have to do. We just want to come in. We want to get our hair done. We miss you. We have so much to catch up on. It's a whole different thing than just coming in for a haircut. And so we're trying our best to keep everyone safe and relaxed. And we know some people are not going to be comfortable. They're going to be a little nervous, and that's okay. They'll come when they're ready. As far as, I'm trying to think if there's anything else. We've been on the phone with each other, all of us stylists supporting each other, just hang in there. The big question, when, for all these weeks. It's been a hardship for everybody.
Right.
And my business partner and I, we feel very responsible for these girls, even though they are self-employed and they rent booths from us. They're our family, and we worry about them. And some of them have been struggling quite a bit.
Right.
And we're just being as supportive as we can. Their clients are being supportive. It's been really heartwarming to know how many of our clients just feel for us and, support us the way they do. And we're so anxious to get opened and try this new normal out. It's going to be different. I've been doing hair for 42 years, and I'm going to be working a completely different way. Every surface has to be sanitized, chair, instrument in between every client. So we're going to need extra help. We're hiring extra receptionists to come in and help us with the cleaning. As soon as someone gets out of the sink, somebody's got to go clean the whole sink, the whole chair.
Yeah.
Everything's got to be sanitized constantly. So it's going to be getting used to, and we're going to do it. We're going to do what we have to do. It's the new normal.
I do appreciate that. And Avante is your hair studio,
Yes,
right?
Avante Hair Studio.
In
Yeah.
Guilderland,
In
correct?
Guilderland, yeah.
Thank you for that. And what a great insight for people to understand that. And again, we're a society who likes to socialize, right? We're a society that likes to gather, and people like it. There's few people that don't like to be around people, but for the most part, 99% of us like to be in settings like that, or that's their big day out once a month to come get their hair done and talk to everybody. So again, like you said, you got to reimagine what it's going to look like, and they're going to do it in a safe manner, and we look forward to opening up on June 3rd and moving into phase 2. But thank you for all that stuff. I also want to remind people, please, as always, we have our mental health number we always put up, and please call that. And we also have you can call the state hotline to complaint form, which we talked about, and the state number is 1-833-789-0470, 1-833-789-0470. Our mental health is always there 7 days a week from 8 a.m. to 8 p.m. as always. Area code 518-269-6634. Our sexual assault hotline number, area code 518-447-7716. And the New York State hotline is always in the 211. Like I've said, we're getting through this, and we're going to get through this together. And if people continue to do the right stuff, we'll get to phase 2, and we're moving in the right direction. So to everyone out there, please, be part of the solution, not part of the problem.